I'm Dr. Carlos Puig. I am the Executive Director of the American Board of Hair Restoration Surgery. That's a position I just took a few months ago, really. However, I was one of the original 14 men or physicians who organized the American Board of Hair Restoration Surgery in 1997. It was an interesting experience. We spoke about possibly developing the board from 1995 on and didn't really start to take serious movement until about 97. The thing that called our attention to the need, we were all hair restoration surgeons, members of ABHRS and also members of the American Academy of Cosmetic Surgery. The thing that drove us to the board exam, though, however, I believe was the blossoming, if you will, of scientific information about the hair cycling and how hair cycling interplays with tissue culturing and how tissue culturing and hair cycling are important to hair loss. And so those physiologies were just starting to become known in this time, along with overlapping with other biologicals, which were starting to be introduced into the therapeutic area, things like platelet-rich plasma and exosomes. We came to realize that our specialty overlapped a lot of different areas of medicine, not just the surgical interventions that you do in routine male pattern hair loss, but also we had been confronted in recent years with patients that had scarring alopecias, with patients that had reconstruction problems, with patients that had systemic illnesses that was causing their hair loss. And so we came to the conclusion around 97 that hair restoration surgeons needed more than just a surgery procedure, that it really is a specialty of medicine, not just knowing how to do a procedure. And that's what prompted the 14 of us to organize the American Board of Hair Restoration Surgery, which ultimately became the American Board and the International Board. The American Board of Hair Restoration Surgery over the last 20 years has become the gold standard for identifying highly qualified hair restoration surgeons. Why is that? It's because these are individuals who have gone out of their way to learn more than just the procedure. They've learned to identify the scarring alopecias. They've learned to make the right diagnoses. They've learned to do long-term treatment planning, which is contingent upon the patient's strong family history or weak family history of hair loss. They've learned how to do repair cases as well as doing just routine cosmetic surgery patients. The thing that's most important, I think, is that people who have taken the time to study these other areas of hair medical therapy have proven to be individuals of higher reliability. And the more reliable their services become, the higher the quality becomes. And the higher the quality of their services becomes, then the more success they have within their practices. So I think there's a real advantage to physicians who go through this process and really learn the entire specialty, not just how to do the procedure. As one of the more senior hair restoration surgeons in the world, I can share with you my practical experience at seeing physicians who successfully navigate the ABHRS exam, acquire a self-confidence that is not haughty, but you can see the difference between them and the individuals who are just doing procedures and are not practicing medicine. And there's a big difference between the two. And I think it's an important difference that shows through not just to the professional peers such as myself, but it shows through to the patients as individuals. My fantasy is that that probably contributes greatly to their professional success. So how do we deal with the credibility gap between a sophisticated marketing practice with little or no knowledge, a mill, if you will, versus a physician who is practicing conscientious surgery? There's really no way to measure a physician's hands in practical application today, a surgeon's hands, right? Once they're out of their training program, there aren't very many people who are going around observing how physicians operate or not. So one has to have a method of measuring, is this person committed enough to the specialty of hair restoration that I can really trust them? Are they a person of integrity? And I submit to you that one who is willing to take the time and the effort to study for and complete the ABHRS exam is one who has demonstrated a commitment to high quality, thoroughly trained patient care. And I think that that's one of the strongest advantages of the board certification process. So if a person's taken that extra time to learn these things and to become fluid with them, then we can make the assumption that they're going to take extra time with their patients and be careful with their patients to do the right thing all the time. This is a specialty that crosses multiple specialties. We all come from different specialties in medicine. So we have plastic surgeons, dermatologists, ENT doctors, ENT surgeons, emergency room physicians, all of which cross-train in hair restoration surgery. I think that it's really important for everybody to go through the board examination process. I think that, yes, you may have learned how the basics of doing a hair transplant procedure in a few cases in a residency program in cosmetic surgery or plastic surgery. But the specialty has a lot more to it than just the hands-on surgery. Huge amounts of information other than surgical information are key to practicing safe, aesthetically sensitive hair restoration surgery, which is what we want every person to do. I have practical experience. In fact, just today, I did a repair case on a patient that had a hairline advancement done a couple of years ago by a plastic surgeon here in town in Houston. And the hairline advancement left a linear scar in front of her hairline and left her with a hairline that was with temporal recession that didn't look natural. Plus, the scars were rather large along the side of her head. And so this was a repair case that we did, and it required some attention to not overpacking the scars, and required attention to hair directions that had been modified by the advancement. And the advancement was all done inappropriately, but it was done by a plastic surgeon. Again, this is a specialty that has a lot more to it than just a few procedures. And becoming a diplomat of the ABHRS is one of the ways that you clearly define that you're committed to the specialty and you're committed to the highest quality of service that you can provide. In fact, I think that a diplomat status in ABHRS is important, not just to your professional colleagues that are in the industry, but they're important to the public as well, because the public recognizes to get there, you have to do something special. You have to do something extra. You have to really understand the entire field of hair restoration, medical diseases, injury cases, reconstruction cases, long-term treatment planning. A lot of complex issues have to be taken into account in the entire specialty. So I welcome all of you to consider coming on board and becoming diplomats of the ABHRS. We're interested in providing high quality hair restoration surgery that's safe and aesthetically natural looking. And the ABHRS is committed to that principle. And joining with ABHRS and getting certified just enhances your standing within not just the medical profession, but enhances your standing within the public as well, because they understand that it took some extra work to get there.